Hey everyone, my name is Jay. I'm 32 years old. I live just outside Aspen, Colorado, and I wanted to share my experience with a herniated S1L5 injury that I sustained in October of 2015. Today is July 20th of 2016, and I decided to do a little video because I watched other people's videos and experiences and read quite a few forums, and reading other people's insights and experiences with this similar injury was a huge help to me, and I thought it might help some people out. So first thing, I assume if you're watching this video, you're probably in a rough way, and I get it. It's a really terrible injury. When I hurt my back last October, I had all leg symptoms. Nothing too bad really. October to December was sort of maintaining. I thought that I had maybe pulled something in my leg, and my injury initially happened. I was weightlifting at the gym, doing deadlifts and squats. I'm a very active and avid skier here in Colorado, and was weight training to get ready for the upcoming ski season. And initially, it felt something going my back, a little twinge, and thought it would get better, work through it. Skied the first month and a half of the ski season, about 20 days or so, and didn't have any improvement in my symptoms, and just sort of tried to power through it. Around New Year's this year, New Year's 2016, woke up one morning and had a lot of numbness and weakness in my left leg, all in my left leg, nothing in my right leg. And that's when it really started to become severe. And I went, got an MRI, had a confirmed herniated disc at my S1L5 level. Went in, saw a spine specialist, started conservative care, which included for me physical therapy, and did that religiously 3 times a week at Valley View Hospital in Glenwood Springs, Colorado. Had a lot of confidence in my physical therapist, and it helped a bit. But my sciatic nerve pain, my radiculopathy that ran from the middle of my back, but was mostly in my upper butt cheek, all the way down to my leg, never improved. Sort of, if anything, got worse and worse over 3 or 4 months. I tried gabapentin, which is, some sort of prescription medication that's supposed to help with nerve pain. That didn't seem to do a huge amount for me. During that time, the first few months when the injury was really severe, I had an insane level of pain. I had drop foot. In other words, I was limping around, couldn't stand in line at the grocery store. I have an office job where I'm on my feet for a couple hours a day and couldn't stand more than 5 minutes. Probably pretty similar to a lot of people that might come across this video. So I was really committed to the conservative care strategies. I read the Dr. Sarno book, the Agosk method. I'm not sure if I'm saying that right, but read everything I could on managing my psychological stress and what I can control just with my mental state, which is really difficult. Became very depressed. Was in pain constantly, not able to sleep for months and months on end. So springtime came around, April, still not improving. Had a big flare up in May, got a second MRI done at the hospital, which confirmed that my herniation had actually gotten a little bit worse. And so I scheduled my first epidural steroid injection. Once again, had a lot of faith in my pain management specialist at the hospital. Unfortunately, when I had the injection over the course of a few weeks, didn't see any improvement. If anything, from about mid-June when I got the injection through the first bit of July, around July 4th, if anything, I had an increase in pain, an increase in some of my symptoms in my leg that were leading to me limping in my drop foot. And at that point, I took I guess I would say, a more aggressive approach to talking to my spine specialist, my spine surgeon, who's Dr. David Miller, located at Valley View Hospital. in Glenwood Springs, Colorado, who I've had a tremendous experience with, has been extremely supportive. I was just hoping to handle this in a conservative way and get better without surgery. So on July 7th, 2016, I went in and saw Dr. Miller, who assessed my strength and my neurological symptoms, my drop foot, my pain level, and immediately recommended me for surgery that was scheduled for July 13th. So, excuse me, I had surgery 1 week ago. I had a microdiscectomy at the S1 L5 level, which evidently is an extremely common surgery. Went in at 6 in the morning and was home by 2 in the afternoon after going to the pharmacy and getting my pain prescriptions, muscle relaxers that they had prescribed for me. When I woke up from surgery, my leg pain was totally gone. And I got up out of bed a couple hours after I woke up from anesthesia. Felt fine. Used the restroom. The nurses observed my condition for a couple hours. And I had no pain. I was a bit spaced out because they'd give me pain medicine and from the anesthesia, of course. So went home and rested in bed a little bit. Got up, walked every couple hours, but I didn't have any pain whatsoever after the surgery. So the next couple days after the surgery, I had a bit of soreness in my back. Felt a little bit tender, like a bruise or a contusion, something like that. But I in general had very, very little pain, if any, really. Just a little bit like what you could expect from having a small incision in your back. My surgery site had an incision maybe about an inch or two long. So that was Wednesday last week. Thursday, Friday, started to get on some short walks, sort of around the block. I live across the street from a great park and was taking my dog over there for some walks and felt fine. Noticed I would get tired pretty quickly. My left leg would get tired because I've been limping around it and feeling very weak for months and months on end. All told, probably about 7 months. 1 week later, I've been out of work for the last week. Feel totally fine. I haven't had any pain whatsoever. Nothing in my back. All the soreness went away about 3 days after surgery. My incision site is healing up really well. No leg pain. To be able to go over to the park and walk with my dog is, without a limp and without any pain, is an extraordinary feeling, especially after, a little over half a year of being in a lot of pain. So, what are my big takeaways from this experience? My only regret is not taking my pain and my discomfort and how much it was affecting my life professionally, personally, not taking those elements as seriously as I probably should have, because I was really, really in rough shape. And 3 or 4 months after the injury becoming very severe, I had, if anything, gotten worse. I hadn't really felt any better, and I wished that I had become a little bit more aggressive and maybe talked surgery more often. Now, I've talked to many different people and read many different accounts of experiences with this kind of injury, and there's a ton of variance. It affects everyone differently. Prior to this, I was extremely active, running, mountain biking, skiing, avid whitewater kayaker, and I think that the balance of all those things being taken out of my life had a huge impact on me. Being in pain all the time had a huge impact on me, of course. I think above all, just not being able to walk without a limp and the foot drop, dragging my foot for months and months on end was probably the worst part for me. So, this is just a video to describe sort of my experience with how I got to my decision to have the microdiscectomy. And I'm so glad that I did it. a week out, I already feel like it's probably one of the best decisions that I ever made. It was not an easy decision for me to come to. I'm very opposed to any kind of aggressive measures for an injury. I've had quite a few severe injuries over the year and always bounced back pretty well, but it just wasn't happening on this one. So the surgery was great. I haven't taken any pain pills since the surgery. I was prescribed narcotic painkiller. I never needed it. I got rid of it. I haven't needed any of the muscle relaxers. I haven't needed ibuprofen, which is really saying something, because for 6 or 7 months I could barely get through without taking ibuprofen several times a day, and certainly couldn't sleep through the night. I couldn't really sleep through the night at all, regardless. But without ibuprofen or the gabapentin, rest wasn't happening in any way, shape, or form. So I know that this can have an overarching effect on your life. I know that it really impacted my social life. Had a really difficult time doing anything. The only thing that I could do at the end of the day was come home from work and lay face down on my floor, sort of in a McKenzie extension, which helped, but certainly didn't make me better. It just sort of helped take the pressure off of that herniated disc. So anyways, that's my experience. I hope that this video can help somebody a little bit. And man, I know it's a lonely road. And without talking to someone who has been through the same thing, it's hard for people to understand just how much it can impact your life, especially going from a place where you feel healthy and active and have a balanced, existence to all that being taken away from you. And my only suggestion would be, get a great neurologist, get a great surgeon, talk to a few different people, talk to a few different doctors. Keep in mind, conservative methods statistically do seem to work for a lot of people. I maybe put a little too much faith in those statistics myself and wasn't entirely honest with my pain level and the severity of my injury. So I wish I had been just a little more honest with myself, and when I really needed help and when I had really been in a rough way, probably around the 3 or 4 month mark, that I had talked to my surgeon. And for me, the injection was a total waste of time, and physical therapy helped, but not enough to make me better really in any way, shape, or form. So just be honest with yourself. If you're really, really in a lot of pain and you have, something like drop foot, or you're limping around a lot, if you're having an impossible time sort of getting by, talk with your doctor, and if they're not receptive, maybe it's time to talk to someone else. My surgeon was extremely receptive to how I felt and everything. Once we had talked about my conservative options being exhausted, everything moved along really quickly. Microdiscectomy happened, and my pain level is gone. I feel like a new person. So I'm so glad that I did it. It was a bit scary. Surgery, I know, is a bit of a scary idea, at least for me. So anyways, I'm sure I left out many details of my story. Thanks for taking the time to listen to this and watch this video. Not sure if anyone will watch it or catch it or whatever out there in internet land. But if you have any questions, just post a comment. I'll be checking up on this thing. And don't worry, I didn't think that I was ever going to really be okay from this. And 1 week out from this microdiscectomy, I can't even believe how good I feel. I haven't had any pain at all. It's totally changed my life. So back to work in a couple days and feeling great. So thanks for taking the time, and let me know if you have any questions at all. I'll be happy to answer them for you. Thanks.